So it would be helpful if we make this very interactive. So you guys could jump in at any point if you have any questions. I will do my best to give you guys kind of a frank assessment of what I think is driving a lot of the issues that we see in health and the kind of intersection between health and the insurance industry. Yeah, the thing about health in this part of the world, it's the fastest growing segment. Oh, it's going to slip if you do. So I can do this. I'm okay? Okay, perfect. But if you do, that will slip if you move from there. That's probably going to slip too, because you have your wrong leverage. Any event, I'll just take this off if it comes off. Okay, that's going to fall. All right. So the health insurance in Southeast Asia is the fastest growing product class by far. It is, and it's only really starting to take off. Driven by a population that's really beginning to get into kind of the sweet spot of aging, GDP growth. And one of the first things people say from an aspirational point of view, as they make more money, they want health insurance for themselves and their family. The problem is that we basically have not done a good job of diagnosing why medical inflation's out of control. What's really driving that? This channel conflict that's always inherent between the groups that are providing the service and the insurer that's paying it, that is allows a lot of kind of disinformation to get out there. So what I thought I would do is I would say a few things about what's not driving medical inflation. So medical inflation is not really being driven by factor inputs. If you go back and you look at sutures, and you look at a silk suture, when they were building the pyramids in Egypt, they were using basically the same suture that they're using today. And if you look at the price point of that, I saw a really interesting article that was done by McKinsey & Company, tracing the cost of the suture over the last 1,000+ years, and how it's gone up well above their estimates on inflation, grain of salt. So it's really not factor inputs. Technology does play a little role. On the fringe, you have better technology every year coming out, and for a small segment of the population, that does increase cost. But again, it's a fringe. Overall inflation does play a little bit. But so then the question is, why is it, if we just take an example, and we look at Singapore in 2018, and I specifically wanted to use pre-COVID numbers, because COVID did a lot of weird things in health and inflation, and so let's pull back from before that. Medical inflation in Singapore was 25 times adjusted CPI in 2018. It wasn't 2 times, it wasn't 3 times, it was 25x. And the primary driver of this is, this is going to sound stupid, but it isn't. It's actually a very hard problem to solve. But the primary driver of this is that no one's really looking at the bill. Right? If you don't look at the bill, it's really hard to price discipline. If you walked into a restaurant and the restaurant knew you never looked at the bill would get larger, I guarantee it. And that, in its crux, in its very essence, and being an entrepreneur is about boiling things down to their essence. The essence of the problem with medical inflation in all of Southeast Asia, not just Singapore, despite how heterogeneous the markets are in Vietnam versus Malaysia, despite the pricing scheme, is that no one's truly looking at the bill. The price discipline nature of the market is broken because the insurers didn't invest in the knowledge infrastructure, and this is a hard investment, by the way, to collect the data they needed to actually then analyze and then use that data to drive efficiency. That really is at its core the problem. Now, different markets have responded to this differently. In the United States, they went down this HMO route. In Europe, they went down a massive nationalization route. But in Southeast Asia, we've stayed basically fee-for-service. And a fee-for-service market that doesn't have people deeply digging into the bill and performing some form of price discipline is going to be problematic, and is only going to become more problematic as more and more people demand a higher level of just basic care. So the insurance industry really hasn't invested in the technology that to transform the data they collect from what I would call in the kind of larger information technology data industry, data debt to a data asset. And what do I mean by that? So if I have 100,000 claims come into my insurance company every year, they come in basically in the form of a PDF. A PDF is locked data. It's data on a sheet of paper that's no more accessible to a machine than this is right here. When you have locked data, you're not going to get access to it, right? Machines can't read it. If it's not tied into a knowledge architecture or some kind of a codex, there's no way to really extract that data. In the larger world of Salesforce or Amazon or Google, that's called data debt. It's not an asset because you can't get access to it. So while a lot of the insurers have giant warehouses, digital or physical, of claims, they have no access to that data, right? So it really comes back to, if you're not looking at the bill, don't expect there to be a lot of price discipline. Now, the second piece of this that's really interesting in healthcare is that the industry, most of the claims are processed by outsourced third-party administrators. And the third-party administrators don't actually have a huge incentive to be creating digital assets, to be creating data assets, because they don't benefit from it. What they're paid for, what they're compensated for, what their incentives are, process efficiently. Process the claim efficiently. Well, if they leave behind 98% of the data in that bill in a PDF, that's okay. They still accomplish their primary objective. It was interesting as I, and this is maybe a moment of maybe too much truth, but about 10 years ago when I started this journey, I never imagined it would be this hard. I never ever fathomed that we would have to build so much as a company to even get into market. The problem is that this was most crystallized recently when I was talking to a very senior insurance executive from a very well-known, one of the largest health insurers in Asia. And he said, Cole, even if I had all the data, even if I really invested in taking every medical bill and really breaking it into its smallest pieces, and I could use that, I had that data at my fingertips. What would I do with it? My whole system isn't set up to run with that data. My actuaries would say, well, now I have to use this, and I'm not really set up to use it. My sales team wouldn't know how to use that data to sell more policies. How would I do it? And what that reflected in me, when I heard that, I really empathized with the person, because I'm like, yeah, that's right. The problem that we face, and health insurance is going to be one of the key battlegrounds that insurers and reinsurers are going to face. It's a harbinger of things to come. Insurers are going to have to become fundamentally knowledge organizations. I promise I have slides that I will eventually get to. But as I heard the first couple of presentations, it made me realize that the audience was in a different position. So they're fundamentally going to have to shift to knowledge organizations. 10 years from now, insurers are going to look a lot more like Google than they do today. There's going to be product managers, there's going to be their own development teams, there's going to be clinical informaticists. They're going to have these pieces, because that's what's going to be required to transform data to an asset. And if you don't do that with this third, and you continue to have somebody else pay and that other person paying, not really looking at the bill, you're never going to rein in medical inflation, right, in a fee-for-service market. And I don't think, given the strength of the medical guilds and the level of fight that we've seen historically in the United States and how long it took to move to a value-based care HMO market, is a huge jump. So I don't think we're going to be there for a long time. So I think we're in this world of fee-for-service, and the highest returns are going to be from investing in data. So just an example of a few ideas that reflect this idea that the consumer has no access to data. In healthcare, what you pay isn't even correlated with the quality of care that you receive. And that's a mind-boggling idea, but it really is true. So you can go to the nicest hospital with the nicest, teak wood floors and brass fixtures, and the overall medical quality of care could be very low for your particular situation. The research doesn't even show, the second one from Vox, doesn't even show a connection between higher medical prices and better medical outcomes. We have over 6,000 medical professionals in our network across 68 subspecialties in Singapore, Malaysia, Hong Kong, and Indonesia. And what we do as a company is literally collect this type of data, and I can tell you there's no correlation. It's what we would all expect for those of you that went to basic business school. It's what we would all expect to happen. In a market that's completely opaque, there wouldn't be anything driving efficiency. Our markets, healthcare is opaque, efficiency is not being driven, right? It's really not complicated. This is kind of an easy way to compare purchasing an automobile versus purchasing healthcare. When you walk into an auto dealership, you can go online, you can walk into the dealership. There's a lot of ways to reliably collect data that's available for the consumer. You can see professional driving tests of the automobiles. You can see crash tests. You can see resale value. You can compare automobile prices, right, up front. So there's a lot of data. Now that data, the auto industry learned a long time ago that by giving the consumers, they needed to collect this data in small package of value that a very lay consumer could understand. And so if they wanted to sell cars, that's what the industry learned to do. So now my grandmother and a professional auto racer can buy a car with remarkably similar efficiency. And the reason they can is the industry learned how to package the data in a way that allowed the consumer to actually value data. If you compare that to healthcare, it's completely opaque. There's literally no data about that's available to the consumer. What is available isn't comparable. There's no standards for it. As a result, there's no empowerment. You know, the biggest decisions, and this is why I frankly started DocDoc with my wife in the first place. Everybody in this room is going to have to make very important decisions about their healthcare for themselves or somebody they love in their lives. They're going to be massively consequential in terms of wealth, but more importantly, they're going to be massively consequential to the people they love. Like, we're going to all hit this problem, and yet the industry has systematically not addressed it. And this is the role of insurers going forward. In all markets going forward, the insurers will have to learn to use data in a better way to help their consumers make more informed decisions. Not just because it'll reduce cost, but it'll also improve quality, right? Because the arbitrage is that large. So, you know, consumers need help in healthcare. These are the three. We did a few thousand reviews in this study, and it turns out that insurers, that when people get sick and they need help, they often call their insurer, they go to their existing doctors, and they go to friends and family. None of these are good ways to make decisions. It results in higher complications and readmission rates. There's a huge amount of psychological discomfort and anxiety, and there's a lot of cost, because one of the things the healthcare industry hasn't really broadcasted is the amount of cross incentives for referral patterns and what that does for cost and what that does for quality of care. What's basically needed is data. And here's another study that was done by a leading consulting firm. And they said, well, what are the 8 main ways that you want to use data to make decisions in healthcare? And it turns out the number one way, which makes sense, is if you already know the doctor and you already know they're good and relevant in what you're looking for, that's best. I agree. Personal experience, I know who to go to because that's relevant. But look at what number 2 is. Data. I'm able to collect data that's relevant to me making that decision. Number 3, a facility that has a good reputation. Well, reputations are built on good outcomes. That's another way to say data. If you look at number 4, has the latest technology. Now we're going back to a proxy. If it's expensive, it must be good. Well, that's not true. Just because it's expensive doesn't mean it's better. Not in a market that there's an implicit assumption that the industry makes that we're going to spend a lot more money on. The implicit assumption is a Rolls Royce is more expensive than another cheap type of automobile. And as a consequence of that, when in doubt, choose the Rolls Royce if it's really important. Well, unfortunately in healthcare, that pattern doesn't hold. So the next layer of using data. So at a high level, if we want to rein in medical inflation, we have to take the data that's already being provided and we have to ingest it. The insurers and the reinsurers have to ingest it in machine readable ways, and they have to be able to use that data, start to use that data. A byproduct of that is what all of your future customers are talking about, and that's personalization and efficiency and customization. Because once you have data in a machine readable way in a system, you'd be amazed how your organization can adjust workflow to reduce fraud, claims, and abuse, to steer patients, to begin to provide things like quality ratings. 25% of millennials say they go out and they actually look for quality ratings around healthcare and hospital before they consume care. That's up 3x from the last 2 generations. If you look, 67% of millennials and Gen Z expect their propositions to be personalized. Personalization is the next step of data. First you collect it, then you make it machine readable, then you optimize the workflow, then you personalize. Right, so you can't skip to personalization. If you look at 71% of millennials would be interested in mobile apps to manage their healthcare. This is how they consume everything else. 74% of millennials said they'd use telemedicine if it wasn't clunky. That's another way to drive efficiency. So I guess the key point is that we need to keep the industry focused on the actual problem they face, which is really about collecting data in machine readable, highly granular ways, and then using that data to drive efficiency. And from there, you can drive personalization. But that's a pretty big shift in mindset. So how is this going to look in health? Well, over time, we're going to see more providers provide data to help consumers make informed decisions about their own care. And that data is going to be primarily around medically relevant markers around cost and quality. And it's going to be packaged in a way that just like a crash test result or a 0 to 100 kilometer speed test in an automobile, it's going to be packaged in a way that the average consumer can understand it and make an informed decision around it. I don't think it's going to be mandated. So this is more of a, and maybe I have a bias. So I've always kind of leaned into liberty and leaned into consumers and free market. You know, I'm a market economist before I did this. So I've always leaned that way. But I think it's going to be really hard for Asia to jump to value-based care because it's a big jump. So if you think, you know, the essence, you know, when one of my partners in DocDoc, he worked for Congress and he worked for the Obama administration in setting the data standards in the United States for value-based care. And he's considered to be kind of a world leader in the field of using, I mean, he's a physician and a computer scientist, and he's got all the, you know, he's got all the kind of yada yada around him in this particular domain. And it took over $28 billion in 6 years and a mandate from Congress to force the US health systems onto a common data standard to share data. Most of Asia isn't even on electronic medical records in these hospitals. So it's a long ways away. And I don't think we're going to see a quick jump to value-based care like you've seen in the US. I don't think we're going to see a jump into HMOs. I think that we're going to, so I could be wrong, but I think it's a monumental journey for a highly organized, super committed country. Under a very unique administration, and in the results of it have been very mixed. So I'm not convinced that we're going to see Southeast Asia move to that approach, because that is the other approach. Either we provide data to help consumers make more efficient decisions, they price discipline the market, or you have some form of congressional government mandate that fundamentally changes the structure of the industry from a top-down approach. I don't think Southeast Asia is anywhere near that, and I don't think it will be for a long time. This is an example of a lot of what the insurers have done is they've spent a lot of time trying to figure out how do I offer more personalized offerings, but they're doing it at a very superficial level, offering things like step counters or offering very basic innovations that really don't drive the core value proposition that the insurer needs to be providing to the consumer. Lemonade, I think, did a really good job. And if you look at their core offering, this is how their consumers said, why are you picking Lemonade? And I thought it was interesting. Number one was their system was easy to use. And it was easy to use primarily because the workflow adjusted once it knew what you were looking for. So I didn't have to ask you 100 questions. After I asked you 3, I knew what you were looking for and I could immediately tailor the workflow. The second is it reduces anxiety. The third is it simplified the journey. The next is it was cheaper. That's automation. Next, save time. Next, quality. Next, providers access. It reduced effort. It was organized. It rewarded me. All of these things are a direct result of collecting organized data and then building workflows from it that help the consumer. And this is really where I think product innovation is going to have to go to reduce medical inflation. I'm down to my last slide, I think. I think the benefits from this are massive. I think you're not only going to be I think you're going to be delivering a fundamentally better user experience to your consumers. And I think that more than that, you're going to be delivering a better level of care at a lower cost. Because the arbitrage opportunities are literally massive because people really aren't looking at the bill.